This question appeared in NEET PG 2023 and the question asks about drug of choice for dialysis disequilibrium syndrome, and your options are A. Ethacrynic acid, B. Mannitol, C. Aspirin, and D. Bumetanide. Now let's learn about dialysis disequilibrium syndrome. So remember, it's a neurological condition, and this condition is specifically seen either patients during or immediately after dialysis. Okay, it is seen in patients during or immediately after dialysis. Generally the symptom will appear within hours of dialysis. Okay, and which are the dialysis patients which are more prone for dialysis disequilibrium syndrome? Remember, any patient who is newly started on dialysis, okay, patients who are already on chronic dialysis but have missed their regular dialysis schedule, okay, patients who are on chronic dialysis but they have missed their regular dialysis schedule. Also, patients with very high blood urea nitrogen at the start of dialysis may be prone for dialysis disequilibrium syndrome. So what is the pathogenesis? Basically, here there is the pathogenesis is there is cerebral edema. And why does this cerebral edema happens? Because of the rapid decrease in plasma osmolality due to dialysis. So when these patients undergo dialysis, there is a rapid decrease in the plasma osmolality, this leading to cerebral edema and causing dialysis disequilibrium syndrome. So what are the clinical features? Mostly they will be mild, okay, and self-limiting. Most of these patients will have mild symptoms and self-limiting symptoms. What can be the symptoms? It can be headache, nausea, sometimes blurred vision, restlessness, confusion. All these symptoms can be seen. In severe cases, you can even have seizures, stupor, even patient going into coma, okay, and a lot of features of increased IOP will be there. So how do we manage this patient? What is the management? What is the management of these patients? So mild, moderate cases do not require much management. You can either stop the dialysis or decrease the rate of the dialysis. Okay, so this is one thing which you can do. Severe cases require management. So remember, the management will be decreasing of blood pressure, supportive therapy like oxygen, management of seizures. Very importantly, if the cerebral edema is more, then you can use Mannitol or hypertonic saline to reduce the cerebral edema. So these are used in severe cases. So remember, dialysis disequilibrium syndrome, it's a neurological condition seen either during dialysis, so towards the end of the dialysis or when the patient is started on dialysis, or even after dialysis within hours of dialysis. Which are the patients who are more prone to develop this dialysis disequilibrium syndrome? Are patients who are newly started on dialysis, patients who are on chronic dialysis but they have missed their regular dialysis schedule, or patients who have increased blood urea nitrogen at the start of the dialysis. So we have seen the pathogenesis, cerebral edema, secondary to the rapid decrease in the plasma osmolality due to the dialysis. Mostly they are mild and self-limiting, but severe cases may have seizures, stupor, coma, all the features of increased cerebral edema. And how do we manage it? Primarily symptomatic, but in severe cases we can use Mannitol and hypertonic saline to decrease the cerebral edema. So the correct answer for this will be B, Mannitol.